to the article Bipolar Disorder, written by Heinz Grunz of the School of Neurology, Neurobiology, and Psychiatry of the Newcastle University, UK, which was posted in Access Science, nearly 29 million people worldwide suffer from bipolar disorder. The purpose of this speech is to inform people of bipolar disorder. Bipolar disorder affects one's quality of life, and hopefully by listening to this, you can gain information on what the disorder is and how it can be managed. Bipolar disorder is a mental health disorder that can be treated to obtain a normal quality of life. I will be discussing what bipolar disorder is, how it is diagnosed, who is at risk, and the treatments and therapies available. As defined by the Brain and Behavior Institute.org, bipolar disorder is characterized by severe shifts in a person's mood and energy, making it difficult for them to function in their daily life. The condition typically starts in late adolescence and early adulthood, but can sometimes show up in childhood and older adults. Some people have this disorder and don't even realize they have it. There are 4 types of the disorder. Bipolar disorder 1 is mainly defined by having a manic or mixed episode that lasts a week, followed by a depressive episode that lasts about 2 weeks. Bipolar 2 disorder is defined by patterns of depressive episodes shifting back and forth between hypomanic episodes. Cyclothymia is a milder form of bipolar disorder, which has episodes of hypomania that shift back and forth between mild depression. Bipolar disorder not otherwise specified is diagnosed when a person may not have enough symptoms or may not be to the severity of symptoms to be diagnosed with bipolar disorder. According to the Brain and Behavior Institute, there are certain signs and symptoms for mania and depression. Some of the signs and symptoms for mania include increased energy, restlessness, increased agitation, increased reckless behaviors such as sexual behavior, and many more. Some of the depressive signs and symptoms include being sad and anxious, feelings of guilt and hopelessness, decreased energy, too much or too little sleep, and thoughts of death and suicide, as well as many more. Diagnosing bipolar disorder is not a simple task, and you can't just have a brain scan or a blood test. You need to be diagnosed by either a psychiatrist or a psychologist and have an in-depth interview. Diagnosis is based on symptoms, course of illness, and family history. According to the MayoHealthClinic.org, if you have bipolar disorder, you may also have other health conditions that need to be diagnosed so that your bipolar disorder does not get worse or your treatment be less successful. Some of these disorders include anxiety disorder, post-traumatic stress disorder, attention deficit hyperactive disorder, addiction or substance abuse, and physical health problems such as heart disease or thyroid problems. Scientists are studying the possible cause of bipolar disorder. They've come to the conclusion that there is not just one factor alone that can cause bipolar disorder. According to the National Institute of Mental Health.gov, they cite the following risk factors: brain structure and functioning, genetics, family history, especially if you have a parent or an immediate sibling who has the disorder, you're a lot more likely to develop the disorder, as well as environmental factors such as high periods of stress or loss of a loved one. There are various treatments and therapies for bipolar disorder. First, there's medication, and some of the classifications of medicine include mood stabilizers, atypical antipsychotics, anti-anxiety medication, and antidepressants. It is important to battle through finding the right type of medicine and the right dosage with your health professional. There may be some side effects, but you should not abruptly stop your medication, for it can cause withdrawals, or your symptoms of bipolar disorder can occur over again. There's also psychotherapy that, when done combined with medication, can be an effective treatment for bipolar disorder. Psychotherapy can provide support, education, and guidance to people with bipolar disorder and their families. Some types of psychotherapy include cognitive behavioral therapy, family-focused therapy, interpersonal and social rhythm therapy, and psychoeducation. As well as therapy, though, you also need to make a lifestyle change. If If you're using illegal drugs or drinking, you need to quit. You need to stay clear of any unhealthy relationships and surround yourself by positive people who have a positive influence on your life. You need to get regular exercise and physical activity. You also need to get plenty of sleep and make sure that it's on a good schedule. As well as all this stuff, there's also alternative medicine such as acupuncture, which is a healthy treatment that doesn't cause problems with medication. In conclusion, bipolar disorder is a complex mood disorder that affects many people worldwide. Although there is no cure, with medication, psychotherapy, and support, one who has the disorder can live a healthy and happy life. Thank you.